Good afternoon, and thank you for joining us today. In Pennsylvania, we are seeing our number of hospitalizations due to COVID-19 increase significantly. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by nearly 1,700 since the end of September. Record high numbers of new COVID-19 cases are occurring across the state each day. Today, we have 7,126 new cases of COVID-19. As you now know, there are three tools in our toolbox to control an infectious disease outbreak such as COVID-19. They are containment, mitigation, and vaccines. Efforts to contain the virus are ongoing. Yesterday, Director Huff outlined testing and contact tracing efforts that address the containment process. On Tuesday, I announced 4 new mitigation efforts in the fight against COVID-19. These include efforts to protect the healthcare system, a new traveler testing order, a strengthened mask order, and recommendations for colleges and universities. The reason I am wearing a mask today during the press conference is because of that strengthened mask order. We have personnel from the Department of Health and from Communications in the room today, thus I am wearing a mask. Today, I would like to give an update on the status of COVID-19 vaccines and their distribution and administration in Pennsylvania. As of this morning, our vaccine distribution plan is now available on our website at health.pa.gov. As I have previously explained, because of the severity of COVID-19, the federal government is working quickly to get this vaccine to Americans. Now, not too quickly, even though it's named Operation Warp Speed after Star Trek, but they have been working on many different vaccines simultaneously, and that's inherently what they're talking about with that operation. The vaccine needs to go through different approaches to get the approvals to make sure that it is safe and effective. Clinical trials on the COVID-19 vaccine continue with 6 drug manufacturers in the United States. We are watching these trials carefully to see how people respond to the vaccines and to learn of any potential side effects. At this time, Pfizer, working with the German biotechnology firm BioNTech, as well as Moderna, are the 2 companies close to finishing their phase 3 trials. Soon after phase 3 is complete, both companies will then request an emergency use authorization through the FDA, or the Federal Food and Drug Administration. Once the FDA completes their review about the vaccines, the FDA will grant an EUA, or this emergency use authorization. The Centers for Disease Control and Prevention, or the CDC, will then review and provide recommendations for the vaccines. Once approved, the department will work to ensure that the vaccine is distributed from manufacturers to providers. It is important to remember that when the vaccines are available, there may be a limited supply, which means that not everyone will be able to get the vaccine right away. As outlined in our vaccination plan, we'll be working to distribute the vaccine in 3 phases. The first phase will focus on reaching critical populations due to the limited supply. This will include healthcare personnel, EMS first responders, critical workers maintaining core functions and essential workers, people 65 and older, and residents in congregate care settings. In the second phase, we anticipate a larger number of vaccines will be available, and this will allow us to ensure that those in phase 1 who are not yet vaccinated can do so, and then we'll start expanding our efforts to targeted populations, including vulnerable populations and those with people with health conditions who may be at high risk. The third phase of the vaccination process begins when we have sufficient supply of the vaccine or vaccines. In this phase, we will begin to ensure the entire population has access to safe and effective COVID-19 vaccination. If the federal approval process remains on track, and we'll still have to see that, we could have vaccine within the next month. However, we do not know how quickly the vaccine supply will meet the demand. It is important to remember again that when the vaccine becomes available, it will not be a cure, or certainly not an immediate cure or end to the coronavirus pandemic. The good news over the last few weeks about the effectiveness of these vaccines in the trials is a very, very exciting and positive development. However, it is critical that all Pennsylvanians continue to follow the targeted mitigation orders set in place, and that everyone do their part to stop the spread of this dangerous and contagious virus, COVID-19. Pennsylvanians need to answer the call so that we stand united to stop the spread of COVID-19. We need to answer the call to wear a mask. We need to answer the call to wash our hands and to social distance. We need to literally answer the call when a contact tracer reaches out to you. And we need to download the COVID Alert PA app to add our phones to the fight against COVID-19. As we continue these efforts to fight COVID-19, please remember, always, stay calm, stay alert, and stay safe. So now I'm very pleased to answer questions, and with me today is Deputy Secretary Cindy Findley, Deputy Secretary of Health Promotion and Disease Prevention, who is leading our COVID-19 vaccine task force for the Pennsylvania Department of Health. Pleased to answer questions.
Thank you, Secretary. Our first question is from Daniel Moore from the Pittsburgh Post-Gazette. Daniel, you've been unmuted.
Thanks for doing this. I appreciate it. I'm just curious if you can describe what resources or guidance you may still need from federal officials to coordinate this vaccination effort. There was a letter last month that estimated roughly $8.4 billion more was needed from Congress just for the distribution of the vaccine. So can you just walk through some of the logistical challenges you may face with this effort? Thanks.
Thank you. So there are significant logistical challenges to distribute and then administer these vaccines to the public in Pennsylvania and throughout the United States. First of all, there's going to be more than one vaccine. We anticipate at least two, the Pfizer and Moderna, but then there are 4 more in the pipeline, 2 that are having their clinical trials ongoing right now, and then 2 that haven't even started their clinical trials yet. 5 out of the 6 require 2 doses, including the Pfizer and Moderna vaccines. The Johnson & Johnson vaccine would only be 1 dose. And as I've mentioned previously, the Pfizer vaccine has to be kept at minus 80 degrees centigrade or Celsius, and that poses significant logistical challenges. So our plan takes all that in consideration, and we stand ready to distribute and administer the vaccines. We have been working very closely with Operation Warp Speed, as well as with the CDC and other federal officials and other states, but we do need more funding. The CDC and the federal government authorized $340 million to the states. That's in contrast to about $8 to $12 billion for the development of the vaccine. $340 million for all of the states is not enough to be able to accomplish this prodigious task. And so we are calling upon the federal government and the CDC to provide more funding for the distribution, the administration, and the communications about the vaccine.
Our next question is from Jason from the Philadelphia Inquirer. Go ahead, Jason.
Try to squeeze in 2 questions, Secretary, if you don't mind. To follow up on Daniel's question, can you be a little more specific about what we still need funding for, what specifically we're looking for, we have a deficit in? And the second question is on record keeping, with everyone needing 2 doses and everyone needing the same dose of the first dose. Can you talk a little bit about our record keeping system, if it's interoperable with other states right now? And if there's any work that needs to be done on maintaining the database of who's getting the vaccine and where.
Sure. Yes, we have a specific budget that we have for the vaccination task force and the plan. Some of the money actually we need for communication. I think that is very important, and that's why I'm doing these press conferences about the vaccine, that we message correctly, that there's going to be limited doses when it comes out, they say that these might be 90% effective. We'll have to see how they work in the field, but they're not 100% effective. So we're going to have masks and hand washing, et cetera. It's going to take time to roll all this out. And then we have to get past vaccine hesitancy. So part of the money we need is for our robust communication plan. And the second question again was?
Sorry, on record keeping, on the logistics of tracking who's gotten the vaccine and who's getting their second dose and where and all that.
Yes, that is going to be a very significant effort. We have a lot of plans now and have developed information systems that will track all this. You're correct. We have to get the right vaccine at the right arm at the right time. And so we'll be tracking all of that. We're working with the federal government in terms of all of this. They have a information technology system called Tiberius, which will be helping us. But it will be a significant challenge, but we're up to that challenge.
Next up is Seth Kaplan from ABC 27. Seth, go ahead and unmute.
Hey, thanks so much. Wondering, the cliche word unprecedented that describes so much of this crisis, is there any precedent for what you're dealing with? When I hear negative 80 degrees and imagine that kind of cooling requirement in pharmacies everywhere, for example, that sounds like something that I would guess hasn't been needed before. But just some kind of perspective, if you can, Dr. Levine, about the difficulty and whether there is any history to guide this, and also, I guess if you could be to whatever degree you can characterize what the state is going to do to help get that kind of equipment into the pharmacies.
Sure. So this has been an unprecedented effort in terms of Operation Warp Speed and the development of these vaccines. Never before has there been a simultaneous effort by many different pharmaceutical companies to develop the same vaccine, and the federal government has been able to sponsor that through Operation Warp Speed. So there are other candidates, but 6 main candidates right now for the United States, all working to develop the vaccine at the same time. And that was done as opposed to some sort of sequential effort, because we wanted to see, to get it done as quickly as possible given the size and scope of the pandemic. So that's unprecedented. Actually, these 2 vaccines are made from what is called messenger RNA, or genetic material. There has never before been vaccines made from genetic material. So, the fact that they are safe as the trials continue and so effective is just again unprecedented. And there are challenges. We're going to try to immunize every single person eventually in Pennsylvania. Think of that throughout the entire United States. So that is a prodigious effort to be able to do that distribution, administration, and then the tracking that was discussed. In terms of the Pfizer vaccine, so they won't be going to pharmacies at first. They're going to be actually going the Pfizer vaccine to hospitals and health systems, particularly those that are able to do mass vaccinations to a lot of people, and those that have the refrigeration technology to be able to keep the vaccine at minus 80 degrees Celsius. The Moderna vaccine will be able to have even a more wide distribution, because that can just be kept in the refrigerator. We have taken all of those issues into account in our plan.
Thank you.
Seth, any follow-up?
No, I'll yield. I know that.
Okay, next up is Jamie Martinez. Jamie, go ahead and unmute yourself.
Hi, Dr. Levine. Thanks again for this. You mentioned at the top of the briefing, and we've been talking about this all week, that hospitals are in danger of filling up. Is there anything specific that the state is doing differently now compared to in the spring in terms of preparing for overloaded hospitals?
Yes. So I made an announcement a couple days ago about the memorandum that was sent to hospitals and health systems and the Hospital Association about about working together. It is really to empower them to take control over in terms of their census, which includes their emergencies, but also their elective procedures and admissions and operations, to make sure that regionally hospitals and health systems are prepared for the surge of patients which we anticipate are coming. We already have increased number of patients, and we anticipate more as we get into December. So we want to empower them to within themselves as well in terms of their plans, but also to collaborate with each other on a regional basis to make sure that we have adequate capacity. What we had to do in the spring was different. Now, again, a novel coronavirus, a new coronavirus, and we're seeing exponential rise. We were seeing what was happening in New York and New Jersey, and so we took the preemptive step to cancel the elective procedures that we talked about to ensure that all the hospitals had capacity. That was necessary at the time, but we want to take a more targeted approach this time, and we really want to empower the hospitals and health systems working collaboratively to do that themselves, and of course we'll be working with them and tracking things.
And Dr. Levine, just to follow up on that and push it a little bit further, I understand that there is this directive to the hospitals to make these preparations and to be proactive about it. But is there a contingency plan that the state has, any state resources that would be activated in the event that the hospitals simply can't keep up?
So we will have contingency plans for everything that might happen in terms of bed availability, staffing availability, and PPE. So we'll have contingency plans if we need to, but we really want to collaborate with the hospitals and health systems to empower them to be able to prepare.
Next up is Paul Van Oosdel. Paul, go ahead and unmute yourself.
Dr. Levine, data from the COVID tracking project shows Pennsylvania lags behind many other states when it comes to the number of daily PCR tests being given. Why is that the case? And what more is being done to increase the number of these tests, which you have identified as the gold standard of testing?
That data is not correct. I mean, it's looking at apples and oranges in terms of that. We have increased our number of tests in a dramatic fashion. So we have actually now, and I think I actually have the numbers, today we are reporting 55,713 PCR test results, in addition to 9,711 antigen tests. So together, that is about 65,000 test results. And we include the antigen tests now in terms of that, because of course we've been distributing those tests and we consider them very, very important. On average now, we have almost 50,000 test results per day. Some of it is looking at the way different states report things. We actually have prodigious testing capability now, beyond what we could have possibly anticipated in the spring. But testing is absolutely necessary to this process, but it's not sufficient. Testing works towards containment. We also have to have the proper mitigation aspects in place, and then medical countermeasures such as the vaccine and treatment, such as the new monoclonal antibody that's coming out. So in the data that we have from the federal government, we're about average in terms of the number of PCR tests, and I think we're above average in terms of the number of antigen test results we're getting back. Our testing system is very up to the challenge.
Because as a quick follow-up, the data I've seen shows that as of recently, as of a week ago, Pennsylvania was only doing about 22,000 PCR tests a day. You're saying that's not accurate?
That's not accurate. So please, our team can reach out to you and give you the accurate information. We have been increasing dramatically. And again, right now, yesterday we reported 55,000. Some of it depends upon whether you're looking at the number of people tested versus the number of tests. And so there are a number of different ways to look at this. It's a little apples and oranges. We can clarify that for you.
Next is Paul Go from the Pittsburgh Business Times. Paul, go ahead.
Thank you, Dr. Levine. I've got two questions. One, I wanted to check in with you about how much cold storage that there is capabilities both in urban, suburban, and rural parts of Pennsylvania, whether there are any holes in that that need to be carried out for the vaccine plan to succeed. And then the other question I have is about alternative sites of care, convention centers, arenas, other things in a case of hospitals being overwhelmed. Where are we with that right now?
So we have identified significant numbers of hospitals that have the capability of doing mass vaccinations and have the cold storage requirements. And they're throughout Pennsylvania. I think that as we roll out the Moderna vaccine, which has less storage requirements, there'll be even more opportunity to make sure that rural Pennsylvania has adequate numbers of vaccines. And we anticipate the Moderna vaccine to come really on the heels of the Pfizer vaccine. So we feel, especially when you combine the two vaccinations, that as we get through phase 1, we'll be very successful.
Next up is Erin McCarthy from the Philadelphia Inquirer. Erin, go ahead and unmute.
Hi, Dr. Levine. Thank you so much again for doing this today. In determining which people fall into that first category because they have serious underlying health conditions, how will you ensure that vulnerable people who maybe don't regularly see a doctor could get the vaccine in that first stage or very close to that?
So again, we have contingency plans in our vaccine plan that we have published in order to get to vulnerable populations that might not have as regular access to primary care. So we will be having mass vaccination clinics available for them. We also will be working with the federally qualified health centers, which are throughout Pennsylvania in those communities, with specific outreach to vulnerable communities. I realize, April, I didn't answer the second question about alternative sites of care. We have no plans to open alternative sites of care right at the present time, but again, we'll do whatever is necessary to make sure that the healthcare system stands.
Thank you, Secretary. Next question is from Amy Wattis. Amy, go ahead and unmute.
Thank you, Secretary. If you could be more specific when it comes to hospitalization capacity, how is it looking in Western Pennsylvania, Southwest PA, specifically Allegheny County and then the surrounding counties as far as capacity goes?
We have significant capacity in Western Pennsylvania. We have significant capacity in Southwest Pennsylvania. So our healthcare systems, we have all of that tracked regionally and in a very granular way, is not being significantly challenged at this time. But we expect, unfortunately, these trends to continue. These are the same trends that have been seen throughout the United States. We certainly have seen in the spring in New York and New Jersey, and now in the Midwest with Wisconsin, North Dakota, South Dakota, Chicago, Illinois, other areas that the health systems can be very, very stretched. And that's why the purpose for the memorandum that I wrote, and we'll be continuing all of those discussions to make sure that we have enough resources to take care of both COVID-19 patients and those that might be ill and require care that don't have COVID-19.
And to follow up a little bit of a different topic you mentioned earlier, the monoclonal antibodies, when will those be distributed to hospitals across the state?
So those are going to start to be distributed this week. So we have our specific allocation from the federal government. We are kind of the middleman in terms of checking which hospitals want it at which times and then coordinating that with the federal distribution system. And then the product will be shipped directly to those hospitals. So this product from Lilly is an intravenous infusion. Takes about an hour. The whole process takes 2 to 3 hours, and it'll be used in hospitals, but not in hospitalized patients. It'll be used in different ambulatory care settings that they determine.
Next up is Jamie Bittner from Fox 43. Jamie, go ahead.
Dr. Levine, I have 2 different questions for you, if you don't mind. The first one is there any possible side effects from these vaccines that people need to be concerned about?
So, every treatment can have some side effects, but there have been no serious side effects. Most of the side effects have been some soreness at the site, maybe some tiredness or headache. But the evidence so far is that they're very well tolerated.
My second question to follow up on that is, with the demand of this vaccine, are you concerned at all about the security of that vaccine and about crowd control?
Well, we'll make sure in our plans, I mean, again, in the first, in phase 1A, it'll be shipped to hospitals. And so we'll work with them to make sure they have adequate security for the vaccine. In phase 1B, going to long-term care facilities, that's actually going to be through CVS and Walgreens. And I'm sure they have taken the precautions, but we will assure that.
Next up is Davine from the Pittsburgh Tribune Review. Go ahead, Davine.
Actually, I'm with the Beaver County Times.
Sorry.
That was 8 years ago. Okay.
Sorry.
Thanks so much for the time to ask a question. My first question for you would be, Dr. Levine, could you expand a little bit on how rural counties like Lawrence, Beaver would be impacted with only having one hospital system in the county and not having as much central location? As far as distribution, can you talk a little bit about the plans for these rural counties?
Sure. So if those hospitals, I don't have exactly which hospitals have the refrigeration capacity at my fingertips, but hospitals that don't, we're going to need to do more of a hub and spokes. And there might be people in those counties that will have to travel to other hospitals to get the vaccination. But however, with the Pfizer product, with the Moderna product, that just needs to be refrigerated. And again, the Moderna, we expect to follow right on the heels of the Pfizer product. That will allow even more widespread distribution through rural Pennsylvania.
And what would you say to folks who are skeptical of, you kind of alluded to it earlier, the whole idea of Operation Warp Speed here. We think a lot about vaccines that take years to perfect, and we're talking about something that took months to get to the percentage we have. What would you say to folks who are concerned about the speed that this was developed?
So again, that was the hallmark of Operation Warp Speed. Now, I understand, I mean, it's a pithy title because it's based on Star Trek, but in some ways it has backfired a little bit because people think that it was that fast, thus it might not be as safe. Really, the hallmark of why it has been so fast is that they have developed 6 or more vaccines all at the same time. You can't usually do that, but they have not only developed the vaccines, those pharmaceutical companies have produced the vaccines. The only way to do that was to finance it all at the same time, and that's why it has taken $8, $10, $12 billion for this project from the federal government, because all of them are receiving funding for the development and the production all at the same time. That is what is remarkable about this. And that's why it's taken a couple of months, which can take sometimes years as you work through with different pharmaceutical companies to happen. They have all either have had or are undergoing rigorous testing in patients through different levels, including their phase 3 clinical trials. There were concerns in the past about politicalization of this process. I feel very comfortable that there has been no politicalization of this process, that science has driven the process. And then when science determines that the trials are done and that they are safe and effective, then they'll be sent to the FDA for their approval, then to the CDC for their review and recommendations, and only then will we get the vaccine. I feel very comfortable with this process. I feel comfortable with the safety and effectiveness of the vaccines, and I'll encourage everyone in the target groups as we roll it out to get the vaccine. And forget the pithy name.
Thank you, Secretary. We have about 2 more minutes left. Next question is Jen Rahill. Jen, go ahead.
Hi, Secretary. Thanks for taking the time. Are additional people getting tested this week due to the holiday? And does the state anticipate testing shortages with the new mandates that require so much more COVID testing, especially for travelers?
There are no testing shortages at this time. Again, we have record number of tests that are coming back. Some of the commercial labs have, the wait time has gone up to 48 hours. We heard from Quest that it was about 48 hours, but we're not seeing the wait times for results like we did in the summer of a week or more, so that's good. And we do not anticipate any shortages at this time. We are getting, for instance, the Buy Next Now antigen test cards from the federal government and then pushing them out to counties that are in need according to our metrics. And I think that there's really quite robust testing available at this time.
Secretary, we're hearing your name circulated in national circles as a possible part of a Biden administration. Is that something that you would consider? Have you heard from the Biden team?
Thank you. It's very flattering. I have not heard from the Biden team. And really, I am pretty busy and laser focused right now, focusing on COVID-19 and supporting and the public health in Pennsylvania. But thank you for asking.
Secretary, we have time for one more question. Deanna Durante. Deanna, go ahead and unmute.
Secretary, we're hearing a lot about when the vaccine comes, but what we haven't heard is a date and when we're going to start seeing these mitigation efforts being lifted. You have businesses suffering, you have people suffering, you have places closed. Philadelphia just announced more severe mitigation efforts than the rest of the state. So when are we going to see? Do you have a date? Do you have a month as to when we may see vaccines actually being distributed? And then once that happens, how long does it take before you come out of this pandemic?
Sure. That's a very important point. So we don't have a specific date, but we have heard very promising news about the safety and effectiveness trials for both the Pfizer and the Moderna. We anticipate, again, this is all through the federal government, that the Pfizer vaccine will come out sometime in December. We anticipate the Moderna vaccine perhaps in late December or the beginning of January. And then there'll be a phased rollout of the vaccine, as I've been describing. A lot will depend exactly how much vaccine we get, which will determine how many people we can vaccinate. And again, both those products require 2 vaccinations. We are in for a very challenging time, which is why we are talking about containment and mitigation and emphasizing how things are. We anticipate, again, that we're going to be rolling this out through the winter and then the spring and into the summer. It could take a significant amount of time to immunize everyone in Pennsylvania. I anticipate that we're going to be wearing masks in 2021, well into maybe to the end of 2021. We're going to need to wash our hands. We're going to need to social distance. I can't predict the future in terms of exactly what will be necessary for businesses. We realize that this is all extremely challenging for the people of Pennsylvania. But you can see the numbers that are occurring throughout the United States. We're not an island. The only state that seems to be stabilizing right now is Hawaii, which is an island. And so we're going to need to meet this challenge. And the governor and I have confidence that Pennsylvanians are strong and resilient and will meet this challenge and will be successful.
So it could be another year before those businesses are able to reopen, before people gather in sporting venues and things like that.
I can't tell you that it's going to be a year in terms of any business. What I anticipate is that we're going to need to take measures such as wearing masks and washing our hands and social distancing for the foreseeable future. But I can't tell you any dates whatsoever.